Hi, I'm Dr. Gurung. I'm one of the ST training currently working in Northwest Injury. Today I'm making a video on mental health services in UK. I'm not using much of a gadget like things popping from right to left. I just have a mic. The reason why I'm making this video is this video will be mainly focused on people who are giving CASC, which is a practical exam for MR Psych, next week. People who haven't worked in UK before, especially international medical graduate, this video might also be relevant for people who have not worked in psychiatry before. Without further ado, let me just focus on the topic that we are going to discuss today. I hope my discussion will be focused only for the maximum 15 minutes, and I just want to um, give experience as if we are having one-to-one conversation and I'm sitting on the next side of the table. Okay, so this is the feeling that I want to give for people who might be watching this video. So without further ado, let us just focus on the services of mental health services in the UK. So generally divide the mental health services into three parts. Okay, the camps under the age of 16. From 17 to 18, some of the services will have transition services to the adult. Okay, from the age of 18 to 65, there will be a general adult services. About the age of 65, it will be the old age services. But recently, for a couple of years, the age demarcation has not been properly defined, and the populations even older than 65, you might see them in the general adult services. So are you clear with the age description? Okay, so now in terms of camps, the population can be divided into inpatient and outpatient. Okay, the patients, the normal kind of patient that you normally encounter in outpatient services might be for ADSD, CAMS, depression, anxiety, conduct disorders, as well as separation anxiety. A lot of the cases that they come over here. So people who are appearing in cask, be mindful. The station might be speak with a mother who has got ADSD, speak with the children to get a history to establish whether the children has got autism, conduct disorder, depression. So this is the camp services. In inpatient, it might be a general inpatient ward as well as the PQ. PQ is psychiatric intensive care unit. This ward is just focused for children who needs less stimulus. In UK, still under the age of 16, the government have said that they need to be in education. So in inpatient setting, the patient might still have teacher just to make sure that they are updated with the education system. So this is the camp services. Okay, and in some services they also have a learning disability services, which might be attached, or it might be a separate services to the learning disability. So I've just discussed about the camp services. So now let us just focus on the adult services. In adult services, let us divide in two parts: inpatient and outpatient. Okay, for inpatient services, it can be a general ward as well as psychiatric intensive care unit. The general ward will be a male ward or a female ward, or sometimes it can be a mixed ward. PQ will be psychiatric intensive care unit. People who need less stimulus, increased risk of harming others, very unwell patient, they are kept in the psychiatric intensive care unit. It can be a female or male. The number of patient normally will be like 4 to 8. So there will be less patient on a PQ compared to a general ward. In general ward, the patient can be from 25 to 30. So this is the inpatient setting. So let us discuss about the outpatient setting. So in terms of outpatient setting, okay, let us go from down and let us come up. Okay, so the bottom, let us say it will be an access team or single point of access, and in some places it will call a start team. Basically, they are like a filter. All the patient that is referred from, let us say, a lesion from A&E or a GP, they are referred to the single point or start team or access team. Basically, they work like a filter. They are the one who does the first assessment, then they decide whether the patient can be managed in GP, which is a primary setting, or it needs support from, let us say, home-based treatment team, crisis team. So I'm going to discuss about those services below. So let us just focus, okay? Remember, there's a team called single point of access or start team, access team. They are the contact where the patient can be referred from various sources. So they work like a filter. Above them, there will be home-based team or crisis team. Okay, the home-based team and crisis team, they provide intense kind of support for 4 to 6 weeks. This services looks after people who have got increased risk of suicide or who needs a bit of support, especially like from crisis, acute stress reaction, adjustment disorder, even with depression, low level of depression or anxiety when the risk is high. Okay, they tend to engage with 4 to 6 weeks. Okay, so I've discussed about uh, um, inpatient before. Okay, so even from the inpatient, people from the inpatient, they have identified the patient doesn't have long-term psychiatric needs. They can be discharged to home base and crisis team. Okay, um, recent studies have shown that people who are discharged from the inpatient services, the risk is very high, risk of suicide is very high, let us say in the first 3 days. So they need a follow-up. So in most of the cases, the home-based team and the crisis team, they provide follow-up, then they decide whether the patient needs a bit of support or they can be discharged to the GP. Okay. So right now in the outpatient, we have discussed about the single point of access, the home-based and crisis team. Okay. About the home base and crisis team, there's something called CMST team. Okay, community mental health services. Patient who has got long-term mental health needs like paranoid schizophrenia, let us say bipolar disorders, long-term enduring mental health disease who needs a support, they are provided long-term support from community mental health services. Okay, in community mental health services, you might have heard about care coordinator. Care coordinator are the ones basically can be a nursing staff or a social worker that make sure that they have got a caseload to look after the patient. So they are the ones who does regular follow-up, regular visit, and communicate this to the team. Okay, I just forgot to mention that in each of the team they will be having a consultant, a middle grade, or a junior doctor. Okay, depending on the services. Okay, so are you clear? So what I've discussed in community is single point of access, home-based treatment team, and CMST team. Linear. Okay. I'm just discussing about the other services. There's one more team called early intervention team. The early intervention team basically looks, the patient who are referred to them are people having first episode of psychosis. Okay, they are referred to this team for early intervention team. The early intervention team, if the patient is referred with first episode of psychosis, generally they are open to the services for 3 years. It's regarded that people who have got mental health, problems with psychosis, if they are provided right kind of support from early intervention team, the risk of having long-term enduring mental health needs will be less. So that's the reason why the early intervention team look for any patient with psychosis. Clear? There's a perinatal services also, especially in some stations of a cars where you have to discuss with pregnant lady. It's always good to mention about perinatal team. Okay, perinatal psychiatry team has recently been funded by the Royal College of Psychiatry, and general emphasis has been put that there is a services which looks after the maternal mental health needs. Okay, they might have an inpatient as well as the outpatient services. Okay, so just remember there's a perinatal team. So people who are appearing in cars, remember if you're discussing any patients who's pregnant or mental health needs, especially like postnatal depression, PPRM psychosis, don't forget to mention perinatal team. Okay, now coming to A&E. Okay, if patient goes to the A&E, in A&E there is also a team called liaison team. In some places it's called red team. Okay, basically they are act like a single point of access kind of thing. Okay, and then they are the ones who decide what kind of services the patient needs. They don't engage with the patient for long term. They are the ones who make a decision there and there. Okay, so in summary, what I've discussed is, people might find it very complicated, but what I've discussed in the summary is, let us divide in two parts: inpatient and outpatient. In inpatient, there can be a general ward, which might be a male female mixed ward, or a PQ. Clear? Okay. Then in community, there's a single point of access, home-based treatment team, CMSD team, early intervention team, and liaison team. Okay, so this is the general structure. In some places, they will be having an addiction services or neuropsychiatric services. Most of the addiction services in UK are private funded or charitable. Okay, so there might be some services um, which are still under the NHS. So the cases that they handle, especially drugs and alcohol, and they have got alcohol detox services. And the drugs that they mainly focus is heroin, because for heroin they have got substitutes like methadone and buprenorphine. Clear? And there might be adult ADHD services, which might be in some places, but it might not be in all the services. So this is, in nutshell, the adult psychiatric services. Clear? Okay. In each of like inpatient, outpatient, there will be a nursing staff, there will be a consultant, junior doctor, middle grade, and it's not possible in some all the services to have middle grade because of the funding and the resources. Okay. um, Now when you know the structure of adult psychiatric services, also keep in mind that the team will also have a psychology and the OT services. I'm not going to go in detail, okay, but just remember when you're discussing about the management, don't forget to mention about biopsychosocial. Bio means medication. This is one of the areas that, especially doctors who have not worked in NHS, or especially the international medical graduate, they struggle. They focus more on the biological side, and they tend to forget. They tend to mention about psychological and OT. Psychological intervention, just mention about different kind of psychological intervention. Then you also mention about the OT is occupational therapy, as well as it provides social services. They are the ones who assess person ability to live in community or what kind of support then they need. So they are the one who arrange the package of care. Okay, so in a nutshell, we have finished the other services. Now going back to the old age, more than 65. Okay, in inpatient, most of the time it will be divided into same like the adult, inpatient as well as PICU. But in the inpatient setting, sometimes it might be the structural, organic, and the functional unit. Structural, organic, it might be dealing with the old age or old age, especially dementia or brain injury. With frontal lobe dementia, Parkinsonism, a lot of things will be there with a psychiatric element or flavor in it. And function will be basically an extension from the general mental health services, just going up and looking. So they also have the same structure like the other services. Clear? Okay, so let us give a pause of 5 seconds. Okay, now I'm going to talk briefly about the mental health act. Okay, it might be relevant for a task when you do a station of a risk assessment. Okay, when you do a proper risk assessment, then at the end, like let us say in the 6 minute, people do struggle if the patient says, okay doctor, I know what you say, but I want to be discharged. Most of the time they struggle what to do. Okay, um, most of the trainees, they tend to say, I'm going to discuss with my seniors. It looks nice to be a safe doctor, but sometimes, when you're assessed at a cost level, they expect you to work as a middle grade or a ST level. In those cases, which I found very helpful when I gave my cast, is because I've already worked like 3 years as a staff grade, and it was comfortable for me to say that, okay, I'm really concerned about you, just assess the insight, and after that, you can even say about, I might request for the mental health assessment. Mental health assessment might be a bit of like an alien topic for people who have not worked in NHS before. Okay, so I'm not going to take much time. I'm going to give you a bit of like a gist or insight. What is the Mental Health Act? In UK, when you assess a patient, and when you say, okay, when you identify a certain risk and you feel like, the least restrictive option would be to offer home-based treatment team. If you identify a patient has got mental illness, and if they have got an insight to decide. Okay, in some cases, if you identify the risk is very high, the patient lacks the insight. Okay, insight is a very controversial topic. Insight, you have to decide on two things: whether the patient understand what kind of mental illness they have. The other thing is they understand what kind of treatment they need. Okay, if they lack the insight to decide these two things, okay, then most of the time, the mental health act is requested. Okay, to do a mental health act, you need two doctors and an amp. Two doctors needs to be a section 12, but in some cases you don't need two doctors to be a section 12. One of the doctors can be a section 12 doctor. One of the doctors might be like a GP who knows the patient. So what they do is they see a patient, assess, and if they feel that the patient lacks the capacity and the patient needs to come to the hospital and the risk is high in the community, then they request something called section. Okay, and the normal section that uses section 2 and 3. Section 2, once can form can be filled. Okay, and request for a hospital bed. Section 2 is generally for 28 days, is for a period of an assessment. But what if the patient already have got established diagnosis? In those cases, what they tend to do is they tend to do section 3. Okay, section 3 is for assessment as well as treatment. Let us take an example of someone who has got bipolar disorder, have stopped taking his medication and had a relapse. In those cases, it would be easy to put on section 3 because we already know what kind of mental disorder they have, what kind of treatment they need. So basically it would be just restarting of the medication. The problem with section 3 is in the paper you have to identify what kind of the bed. Okay, so that might be an issue. I'm not going to go in detail, but people who are appearing for a course next week, just remember, when you do a risk assessment, and especially in stations where you struggle, where the patient says, doctor, I want to go, make sure that you check the inside. Uh, uh, as you know, you will cover the history, mental state, and the risk. Okay, but if you identify the risk is too high, um, I don't think there'll be anything wrong for you to mention that I might be requesting for a mental health act, and explain briefly that mental health act is there will be two section 12 doctors and amp. Amp can be a social worker. They'll make an assessment, and we just want to make sure that you are safe, and we want to do the best. We have got the best interest for you. Okay, so that's it. I've spoken for almost like 20 minutes, and I hope this video, people, especially who are appearing for course next week, might find it very helpful. Okay, so all the best for the course next week. Take care. Thank you.